We've talked a lot about racial disparities when it comes to the pandemic. Minority communities have higher infection and death rates.
Well, now Phoenix is one of 5 cities chosen for a new study that will look at lung health and the disproportionate impact COVID has had on minorities here. Monica Garcia joining us live to explain this. Monica?
Well, guys, Black, Hispanic, Native Americans, they're all dying at a rate nearly 3 times higher than white Americans from COVID. And while minority access to health care has always lagged, COVID is really highlighting the disparity.
It was a part of my life when I couldn't afford health care.
Adolphus Kendall knows all too well what it means to go without.
In between work.
But going without health care and skipping annual checkups was by far the worst.
I have enough conditions to be an encyclopedia.
Since the outbreak, people like Kendall, minorities often on a lower social economical level, are getting sicker and dying at a faster rate.
Are more likely to contract a chronic respiratory disease, which puts them again at significant risk of not only COVID-19, but the severe side effects of that.
Rudy Anderson is with Chest Foundation, a national nonprofit taking a closer look into lung health here in the Valley this week.
To really listen in to many of the folks that have been disadvantaged, felt they've been marginalized.
Phoenix is amongst 4 other cities chosen for the study, partly due to our COVID rates and high minority population, and to bring awareness to the impacts COVID has on the lungs. In some cases, worse than smoking, like seen over and over again in chest x-rays like these.
But also due to the fact that there's a lack of trust and buildup between the healthcare system and the patients.
Kendall now works with a coalition of groups, including the Chest Foundation, working to get minorities vaccinated by addressing the mistrust rooted in structural racism.
We see this disparity, it's now the Jim Crow of healthcare.
So based off all these findings, it's going to take several weeks, but the group plans on creating programs and working with other nonprofits here in town to fund different groups to get minorities access to better health care and treatment, especially when it comes to COVID. In Phoenix, I'm Monica Garcia with Arizona's Family.